What about adults and healthcare workers? Well, already in this room, I would suggest that we are a demographic indicator that still 30% of people that work in the NHS remain unvaccinated. Now, whether we have inspired and empowered them to realise the benefits of vaccination, or whether, as with one of my colleagues, they were needle phobic, or whether, as some of the sort of urban myths people think the vaccine doesn't work, we have to listen to the people that do not take vaccines and find out why. And we then have to craft our messages with individual citizens, because those that are eligible should welcome the opportunity of being vaccinated or be medically exempt. Now, there is medical exemption. I've written a paper on it. 0.3%, 0.3% of the population are medically exempt because they might have an egg allergy or they might be medically exempt by GPs. So why, in large foundation trusts or in general practices, do 40% of people appear to have an egg allergy? So, if you've eaten one of the egg sandwiches today, you do not have an egg allergy, right? So, we have got to get to the bottom of why people resist the influenza vaccine. We are improving healthcare worker uptake, and London and private care led the way. I don't know if you're aware, but a very important part of the health system called care homes, and believe me, they're paid far even less than you. Care homes were left out of healthcare workers until this year, and some of the practices and some of the pharmacies opened up their doors and began vaccinating healthcare workers in care homes and home care as well. And we have reduced A&E attendances by residents in care homes by 65%. And the case study we use is, hands of anyone in Ealing. In Ealing, on the 23rd of December last year, the year before, 11 ambulances were ordered to 11 residents in one care home, transporting elderly patients to A&E for a blood test. And we had to say we need to do something different, because one of them, 92-year-old. And so working with our colleagues in health protection and working with our colleagues at the CCG and working with our colleagues across the system, we now have a new protocol whereby we send someone from general practice into the care home, and in the space of 2 to 3 hours, they can assess all the clients, residents in that care home, and prescribe antivirals and prescribe influenza vaccines for those people that haven't got it. And be more compassionate to the position of that elderly citizen and not take them out of their bed to go and get examinations, etc., to see a GP in A&E. So by listening to you, we've shifted the protocol, and we're sending clinicians to residential homes, etc., and we've offered everyone that works in a care home, whether you're a clinician, whether you're a manager, whether you're the chef, whether you're the domestic assistant, we as commissioners and primary care have a duty to offer those people a protective influenza vaccine.